Celebrating the baby boomer lifestyle. This is Boomer Life with Sterling Fox on AM 650.
Welcome back to Boomer Life. Our guest in studio, audiologist Dr. Ted Venema from Next Gen Hearing and Mainland Hearing. Next Gen Hearing on Vancouver Island, Dr. Ted, and Mainland Hearing, well, here on the Lower Mainland.
Yeah.
Doesn't that make a whole lot of sense?
Mostly it does, and here's an inconsistency. There's a few Next Gen offices in the interior.
That's
in
right.
Kelowna and
That's right. It's a
Just to
growing,
bug you. There has to
growing
be.
enterprise. Now, Dr. Ted is an audiologist, like all of his colleagues at Next Gen and Mainland Hearing, all of whom can conduct hearing tests. One of whom, Dr. Herman Lee at Mainland Hearing Metrotown, conducted a hearing test on moi a few weeks ago. And I found it was absolutely fascinating. I'm really happy I went. And it just because of the learning experience, just to go through something you've never done before. It was completely painless. Dr. Lee was a really nice man, and now I know more about my ability to hear or not. And you have my marks. So Dr. Lee described we're only halfway through the test, and I want you to take us through the whole thing. But Dr. Lee, at the end of it all, described my hearing as being pretty typical of a boomer guy my age, not very profound at all.
No, hearing losses come in
Excuse me.
having no hearing, which is if it never takes you more than 25 decibels to hear any one of those 7 octave frequencies we talked about.
Right.
If it takes you about 25 to 40 decibels to hear a pitch, or one of those pitches, you're said to have a mild hearing loss for that particular tone. If it takes you between 40 and 60, you've got a moderate hearing loss. If it takes you 60 to 70-ish, moderately severe. If it takes you 80 decibels, you got a severe. 90 or more, you have a profound.
Right, right.
So the degree of hearing loss is what's tested through those headphones we talked about.
Okay.
Once that's done, the headphones are taken off and a little black box is placed on the bone behind your ear. Now, if you put your finger up just behind your ear and you'll feel that round bone on your skull.
Right.
That's called your mastoid bone. A little black box is put on that and the tones are given to you again. And you're asked to raise your hand when you hear these tones because now you're hearing through bone conduction.
Yeah.
Now, let's say you had a hearing loss through the headphones. And let's say your hearing loss was due to an earache like a kid has.
Okay.
Okay, so you'd have a hearing loss through the headphones. You put that thing on the bone, however, and deliver the tones through that. You are bypassing the outer ear canal. You are bypassing the infected middle ear that's giving that child the earache.
Right.
And the sounds are being delivered straight to that inner ear or cochlea, and those hair cells are excited. And
Well,
they
just
wake
on
up.
the other side of the bone.
Yeah.
Right? Okay.
And so the kid has normal hearing that way through bone. Hearing loss through the headphone, through the bone, the hearing is normal. Mom goes, yes. Doctor says, yes, it's just an earache. It's just an infection.
Right.
We can treat medically.
Sure.
Now, that's only 5% of hearing loss.
Okay. Now, what is that test called, Dr. Ted?
Bone conduction.
Bone conduction.
Yep. The bone. The
That's
testing
how
by-
you're hearing that way as
through
it's
bone
conducted
conduction.
through the bone.
Yep.
Okay.
Hearing through headphones is called air conduction.
Okay.
So headphone or air conduction testing just tells you the degree of loss.
And those are all the tones.
And that's the tone. Now
Right.
bone conduction, they're delivering the same tones to you again, but this time it's just through the bone.
Right.
And that's called bone conduction. And so that test always follows the headphone test.
Okay.
First you raised your hand when you heard the tones through the headphones.
Right.
Now you're raising your hand when you hear the tones through that little box placed behind your ear.
Right.
Now here's what happens in 95% of hearing loss, especially boomer hearing loss, people who are hitting the age of 60, closing in on 65, okay? You may have a hearing loss through the headphones. Now the headphones are taken off and that little box is placed on the bone behind your ear.
Right.
Guess what? You have the exact same degree of hearing loss.
Ah.
In other words, when you bypass the outer, you bypass the middle, the hearing isn't any better. It is the same.
Ah.
That points the arrow of culpability or flaw to the inner ear.
Oh.
And now you cannot fix that. That's not medically treatable. 95% of people with hearing loss have inner ear hearing loss. And that term, there's a term for it.
Okay.
That term's called sensory neural. Sensory, like sensory perception.
Sure, yeah.
Sensory,
Yeah.
neural, as in nerve, neural.
Okay.
Sensory neural hearing loss. 95% of hearing loss is that.
Oh, so it's typical then to flip that coin.
Yep.
that we hear as well through our inner ear as we do through the bone?
The whole headphone.
Oh,
yeah.
okay.
And normally this is what happens,
Right.
okay, in the hearing test. So air conduction or headphone testing is done first. That tells you the type. I should say, Mark, that tells you the degree, the amount. Do you
Okay.
have mild, moderate, severe, whatever.
All right.
Then the headphones are taken off. The bone thing is put there, and now we know the amount. Now let's try and tell the type. So that bone conduction tells you the type of hearing loss. Is it conductive, like kids with an earache?
Right.
Or is it sensory neural, like elderly hearing loss?
Like
and
95% of us
Yes.
are
Yeah.
dealing with.
So now the hearing test is, all the tone testing is done. You now know the amount of loss in each ear, and you know the kind of hearing loss in each ear.
Okay.
You've done two things. Now the headphones are put back on you
Yes,
again.
I was just going to say, but wait a second, that wasn't my experience
Yeah.
because there was more.
There's more.
That's right.
And that's called speech testing.
Okay.
And that's done under the headphones again. That little thing is taken off from behind your ear.
Right.
That little black box. Headphones are put back on your ears again. And now let's talk about speech.
Right.
And we'll do. Now I'm going to say I'm going to find out what you think is a most comfortable loudness for your right ear. I'm going to talk in your right ear, and I'm going to say, pretend that you've got a volume knob in your hand and I'm your radio. Would you turn me up or down to sound most comfortable? And you say, I'd go up a little bit or I'd go down a little bit,
Yeah.
and I jot what that is.
Right.
Oh, by the way, speaking of jotting down, on the hearing test, O's, we play tic-tac-toe. The X's are the left ear and the O's are the right ear.
That's what
That's
that
what we
was.
draw on
Okay.
the audiogram.
Okay,
And
because
those are your
I saw my chart
Yes.
afterwards, and it was full of X's and O's.
Yes.
And I thought, wait a second. here.
Yeah, he's just playing
He
tic-tac-toe.
was
and it's
playing
like,
games. He
he's
was
bored.
putting me. He wasn't.
No.
He was excellent, by the
And
way.
he's marking down the degree of hearing loss
in
that
the
you
X
have.
ear and the O ear.
Yep.
Okay.
That's what we do. Okay.
Interesting.
Sometimes people make the right ear red O's, and they make the X's blue.
You know, it was interesting, though, when you were asking earlier, when you said typically the audiologist will ask the patient,
Yep.
let's start with your better ear.
Yes. Yeah.
You know, what he noticed, I don't think of myself as having a better ear, but when I was sitting opposite Dr. Lee having our preliminary conversation, he noticed something about me because that's what you guys do. I tend to turn my head slightly to advance my right ear slightly forward than my left, which means, what is that? Is that my better ear, or
I looked at your hearing test. Your ears are fairly close. Your right may be a shade, like 5% better, but not a lot.
Yeah, because I'd never noticed that. He said, you know, you're doing something,
Yeah.
and I said, well, what am I doing? He said, you're
yeah.
indicating with your head that you're preferring to hear with your right ear over your left.
And it may be that your right ear has slightly better clarity of hearing, but essentially, I always say to someone too, what's your better ear? And the person says, well, and if they're hemming and hawing, they don't have.
They
much
don't
of a
have
better
one,
ear.
right?
It's like you'll get your other person who says, "Oh no, my right ear is good. My left ear. If I sleep on my right ear, I can't hear anything."
That's right.
You know, some people say that.
And do we have that, Dr. Ted?
No.
Is it possible to lose hearing in one ear and be perfectly normal on the other side?
Oh, sure.
Okay.
You might have been a trucker and you might have had your left window open as you drive. That ear might have more noise-induced hearing loss.
Okay.
Okay. You might be a dentist or a target shooter and you're right-handed or left-handed. You know, you might have had a walloping ear infection in one ear that left it permanently scarred or damaged.
Okay, sure.
There's many reasons you can have hearing loss in one ear. Oh, absolutely.
Now, the speech test I found most interesting because Dr. Lee told me, he said, they're going to say a short sentence, but you only need to say one word.
Yes.
And so the short sentence every time is, you will say, and then the mystery word.
You know why they do that?
Why?
So you get no context. We never say, see the big black cat. Okay, I don't want to test your linguistic ability. I want to test your clarity. So out of nowhere, with no context, say the word thin. Say the word cat. Say the word tree. And you're given no visual cues. I'm not allowing you to see my face.
Absolutely
either.
not.
I'm
no.
testing the clarity of your hearing. Because with nerve or sensory neural inner ear hearing loss, the clarity of hearing often dissipates as well.
And you can tell when someone's not hearing a word clearly because they're not repeating it properly.
Right, exactly. So you mark that down in percent. because you're going to get, look, if somebody only gets 50% of the words, that's as good as it's going to get.
Right.
I mean, that person's hearing you in a quiet room under headphones, and if he or she's only getting 50% of the words you said, imagine how that person's going to cope out in the real world with background noise in a restaurant.
Right.
You know, it's only going to go down from there.
Absolutely.
So that speech test is incredibly important for counseling, for explaining to someone to the limitations of hearing aids so that he or she walks out with realistic expectations of hearing aids.
So is it easier, I know we need to take a break here, but let's just finish this thought.
Yeah.
Is it easier when a person is incapable of pronouncing or repeating the words in the speech test? Is it easier for the tester then to explain to that individual, you're not hearing certain words, you weren't able to repeat certain words, and it's because it's not a deficiency of character.
No.
You just can't hear very well.
No, you're trying to help the person.
That's right.
Really, you're giving the person information.
Right.
Honestly and truly. And you're saying, look, the clarity of your hearing is not so good. So I want you to look at a hearing aid like a cane for a bad knee. It's going to help, but it's not going to replace the real McCoy.
Right.
Please don't
But it'll
think
sure
I'm gonna...
get you around a whole lot better.
Yes. I can't make your hearing back like when you were 10.
Right.
Okay? But I can sure help you. And that's the issue.
And remember, hearing tests are free. Our guest is Dr. Ted Venema from Next Gen Hearing and Mainland Hearing, and this is Boomer Life here on AM 650. Enjoying this? Oh, I sure am. We're back with more right after this.
It's all about the baby boomer lifestyle. Boomer Life on AM 650.